Good evening, everyone. My name is Lisa Deal, and I'm the Regional Coordinator for West Virginians for Affordable Healthcare. We, along with West Virginia Citizen Action Education Fund and the West Virginia Center on Budget and Policy, welcome you to West Virginia Healthcare for All campaign's North Central Candidate Forum. The West Virginia Healthcare for All campaign has one overarching goal: working to win the right for quality, affordable healthcare for all West Virginians. So let's get started. Our moderator tonight is Adam Stark. So Adam, why don't you take it away?
All right, thank you, Lisa. All right, and good evening to everyone out there, to our audience and to our candidates. And welcome to the North Central West Virginia Healthcare for All Candidate Forum. Tonight's event is part 2 out of 4 of our statewide Healthcare for All campaign to learn from each one of our candidates. All right, my name is Adam Starks, as Lisa said, and I'm the Healthcare for All Coordinator for Barbour County. And tonight's moderator. I have the pleasure of introducing 5 candidates throughout the North Central region, and our audience will have the privilege to learn from their insight. All right, so without further ado, I'm going to start with House District 44 Democratic candidate, Ms. Robin Cutlip. All right.
Hello, my name is Robin Cutlip. I am running for House of Delegates in District 44. I am a mother, a wife, a grandmother, a public school teacher, and now I'm throwing my hat in to run for House of Delegates. I decided that I needed to run for House of Delegates when I realized that the voices of my fellow teachers and school service personnel were not being met, heard, or cared about. So I've always taught my students, when someone needs to stand up for you, or you need to stand up for someone, then you need to do it. So I thought I better lead by example, and I'm standing up for my fellow educators, and I hope that I can make a difference in our area. District 44 is one of the most beautiful districts in West Virginia. It is all of Webster County, a part of Upshur, Randolph, and a part of Nicholas County. So I'm very excited to be here tonight because every West Virginia deserves the best health care that they can possibly get. My students, my families, everyone in my area deserves the best that they can get. So I'm very excited to be here tonight.
All right, thank you very much, Robin. Next up, we have House District 48 from the Mountain Party, Mr. Steve Hamilton.
Thank you. My name's Steve Hamilton. I am District 48, which is Harrison County. I've been involved with advocate for healthcare since probably mid-90s. 92, I ran my first office. I ran for a school board and got elected. And ever since then, I've been involved in every election cycle. I've either volunteered for a candidate or I was working on an issue. Somebody came to me, and I'd always talked about running, but somebody came to me past November and talked to him about running. There was going to be an open seat in Harrison County. I decided to join it because my passion is with the opioid epidemic, and I think I have some solutions, and I really want to be a part of solving that epidemic in this country, in this state especially. And along with that goes a lot of mental health. I'd like to find ways to make mental health more accessible and more readily available and more affordable. So that's pretty much the gist of why I'm running. It's got to do with healthcare and the drug addictions. So with that, I thank you very much.
All right, thank you, Steve. All very important issues for sure. All right, and next up we have House District 53 Democratic candidate Corey Chase.
Hi, everyone. Thank you all for having me. I'm so excited to be here. My name is Corey Chase. I'm a candidate for the West Virginia House of Delegates, and my district includes parts of Tucker County and parts of Preston County. I'm running because, and I ran in 2018, but I'm running because I feel like our leadership in Charleston is basically bought out, and they're not addressing our needs. And healthcare is huge for West Virginians. You know, if you follow healthcare policy in this state, you know that 1 in 3 people depends on Medicaid. We've got like over 800,000 people that have pre-existing conditions, and we live in the richest country on the planet, and we don't have universal health care or Medicare for all, and that's a problem. I think that our seniors are at risk. We've got a highly vulnerable population in this state. We have a brain drain. Most of my friends have left this state for greener pastures and other places. And if we don't address this problem, we're going to keep getting what we've always got. People are going to keep leaving. And so we have to make sure that healthcare is a top priority. And as a delegate, I will work to make that happen. And I totally appreciate everybody for being here. And I'm glad to talk about this. Thank you guys so much.
Excellent. Thank you, Corey. All right, next up, we have Senate District 11, Democratic candidate, Ms. Denise Campbell.
Good evening, everybody, and thank you so much for giving me the opportunity to participate. My name is Denise Campbell. I live in Elkins, West Randolph County. I'm running for the Senate, the 11th Senatorial District, which consists of 7 counties. And just to be sure I don't miss any of them, because sometimes when you get nervous, you sort of forget, but it is Grant, Nicholas, Pendleton, Pocahontas County, Randolph County, Upshur County, Webster County. It is a large district, but it's a very rural district. And that's one thing that I like to focus on, is realizing that living in a rural area is a lot different than living in a non-rural area, even when we talk about West Virginia. And I have a special needs son, and I found that out personally. And I don't believe that where you live should dictate the services that you have. But I have been a registered nurse for 27 years. I teach at Alderson Broaddus University in the School of Nursing. I've been in healthcare for 30 years. I served in the House of Delegates for 3 terms representing Randolph and Pocahontas County. But one thing I believe is that if we work together, we can solve a lot of these problems. But when we keep playing partisan politics, we get nothing done. And my goal is to get people working together so that we have a healthier West Virginia. Thank you.
Great job. Thanks, Denise. All right, next up, and our final candidate for tonight, Senate District 14, Democratic candidate, David Childers.
Hey, everybody. Thanks for having me. I appreciate it. My name is David Childers. I'm running for State Senate of the 14th District, which, like Denise said, she's got a big district, and 14th District is just as big. It's 8 counties, 4 full counties, and 4 partial counties. You have Hardy County, Tucker County, Preston County, part of Grant, part of Mineral, Barbour, and Taylor, and a little section of Monongahela County. So it's a pretty big district. A lot of rural area as well, and everybody is 100% is actually right. We have to do something with our health care to keep people here. We have no health care whatsoever right now at all. They want to strip the ACA. We have an attorney general that's wanting to ban pre-existing conditions and get rid of that. We have to stop that as well. We have to pass legislation to make sure we take care of our seniors, our young pre-existing conditions, and in all of it. We just have to. You have to start doing what's right and what's for the people. You know, the partisan politics has got to go. It just has to go. We have to start passing common sense legislation, and it starts with electing the right people. Thank you.
All right, excellent. All right, thanks to all of our candidates tonight. I just want to make it clear that we did go through every effort to invite candidates on multiple occasions. We thank the 5 that accepted our invitation. All right, we have 4 Democratic candidates and 1 Mountain Party, but we did invite across the spectrum, including Republicans who we could not get to join us tonight. That being said, I do think we'll get a diverse bit of insight from these candidates tonight, so I'm looking forward to that. Without further ado, I just want to lay some ground rules. Each candidate will have 1.5 minutes to answer the question. If you need me to repeat, please just let me know. But I would encourage you to not zone out throughout the process and try to stay alert. We are going to mix up the order for each question, so just be, I guess, keep you on your toes a little bit. All right, so first up, we have Robin Cutlip. And I'll pose this question to all of you, but she will go first. With West Virginians experiencing some of the poorest health outcomes in the nation, what do you feel can be done to improve the long-term health picture for West Virginia families? And what would be your priority areas?
Well, the first thing I would like to see happen is to do away with the IDD. And as a special education teacher, that is definitely something that I would like to see done away with, so that our until students or youth with intellectual development disabilities are not waiting on a wait list forever just to be able to receive services that they should be getting as soon as they apply. I would also like to work to make sure that prescription drug costs are lowered. There is no reason why a family in West Virginia should be choosing between groceries and their prescription medication. We also need to make sure that our internet is up and running in all these rural areas so that we can we can compete with other states, so that our citizens do not have to leave here when they need to have these specialists. We have so do not even have access to vehicles that could greatly benefit from telemedicine, but yet we can't make it out of the county to get there. I also want to make sure that we continue programs such as WIC, Help Me Grow, West Virginia Birth to 3, and the West Virginia Head Start programs. These are great programs, but we need to make them available to all West Virginians.
Okay, excellent. Next up, Corey Chase.
I wholeheartedly agree with everything Robin said. And what I would add is, and I'm sorry for you guys who have to go after us, but I would add early screening, preventative medicine. I've been a massage therapist for over 17 years. I've worked with senior citizens. I've worked with young people, and things like massage and acupuncture. These are preventative medicines and alternative medicines that should be covered. Auricular acupuncture, by doing acupuncture in the ear, can help people with opioid addiction and pain. And another thing I'm really passionate about and think would be important for West Virginians and for anybody really is access to good food and farms, local farms and food. I'm a gardener, and I love making a compost pile. I love adding real local natural nutrients to the land, and farming is huge. And we export a lot of products from our state to other places, but we need more food in the schools, more food in the senior centers, more local nutrient-rich foods, so that people aren't eating garbage and being sick. I mean, if there's any main problem with overall health, it's eating food that's industrially produced and is not nourishing your body. So those are my two big things that I would add.
Okay, thank you. All right, next up, we have Steve Hamilton.
Okay, sorry, I was trying to get off mute. Yeah, I agree with everything has been said. I think that we should look at expanding Medicaid more. I think there's still plenty of people that are being left out of health insurance because Medicaid is so stringent on to get into right now. Another place that I really want to see improvement on is medicinal cannabis. I think the medicinal cannabis can solve a lot of health issues that we're not even getting in touch with. For instance, I talk about opioid users. Cannabis has been, medical cannabis has been seen to be just as effective for some people as methadone. So I think that's a much more less harmful ways that we can do with the opioid addiction. I'm not knocking methadone and Suboxone, but it is just substituting one drug for another. And there's no weaning off process. And I think that's something that needs to be looked at. I think overall, we need to look at this for-profit industry and try to get healthcare out of the for-profit and make it for the people. Thank you.
Okay, excellent. All right, next up we have Senate candidate Ms. Denise Campbell.
Well, I do agree with what the previous candidates have mentioned. Myself, as being an educator and a nurse, I really believe it's very, very important that we start education of diseases that we are very high risk for. I myself was just diagnosed with diabetes a year and a half ago, have a family history of diabetes. And, I think if we are proactive and we have preventative measures put in place, studies have shown that if we do assessments and prevention, and provide those early services instead of waiting till somebody has multiple health problems and then we want to try to give them health care. We can save money if we do prevention and have access to care. And I think having screening done at young ages, I know there are programs in the school system that are already screening for heart disease for our children when they're in grade school. And I'd like to see more screening and more education.
Great. Thank you, Denise. All right. And finally, last but not least, David Childers.
Thanks, Adam. That's a good question that you asked there, and I have to say I have to agree with a lot of what the other candidates had. Well, also what I want to emphasize on is that we're going to have to need help from the Fed. We're going to have to elect people also into the Fed that is for Medicare for all, because that is most definitely needed. But also, I have to agree with what Corey was saying. If we can partner with the Department of Ag, get people the proper foods that they need, that is just going to be a great help. And the expansion of Medicaid, we need to expand Medicaid. There's a lot of people out there that just doesn't have access to the proper health care that they need, or they're underinsured. And it's just ridiculous. Expand Medicaid, expand school-based health clinics, quadruple the reach of the state's free clinics. This is what it just needs to be done. It's what's right for the people. We have everybody else in there getting, padding their pockets from out-of-state corporate entities and everything else, and that needs to stop. We need to do what's right for the state and do what's right for the people of West Virginia.
Okay, all right. Now we're switching gears. At the forefront of our mind, everyone's mind today is COVID-19. So given what's going on now, how do you propose that we protect our students, teachers, school service personnel, while at the same time providing equal access to quality education across the state? This time we'll start with Corey.
Sure. As some of you probably know, Tucker County, where I'm from, is unfortunately #1 with COVID. The rate is blowing up right now. We've got a lot of tourism in the area, and my daughter is in quarantine because one of her classmates was exposed, and some of the public schools have had cases and they don't have enough teachers. The teachers are, they can't find enough substitutes, and so they're closing. And it's my opinion that we should have gone virtual from the start. Honestly, I think that since we're didn't go virtual, we need to make sure that we have all the cleaning supplies, we have extra staff, and the fact that the governor is changing the colors on this map is ridiculous. But if we're not going to prioritize the health of our kids, it's a huge risk, because we have grand families raising kids all over this state, and there are too many risks for kids who don't understand the severity of this virus, this novel coronavirus, that they're going to bring this thing home, and people are going to get sick or die. And it doesn't mean you either don't have the disease or you die. You can have debilitating illnesses with organs and all kinds of problems. So we just need to prioritize health. And if we don't have cleaning supplies and make sure that everybody's safe, then we should go virtual.
Okay, thank you, Corey. Next up, we'll hear from Steve again.
Hello, am I on?
You're on.
Okay. Yes, I think the COVID has really shown a light on how poor our healthcare system is right now. I do agree that I think that we need to look at schools and what's best to service schools. But I have a real problem with that, because if we're doing virtual schools, as somebody mentioned before about broadband, we're creating a two-tiered system with that, because we're going to have those that have internet access a better education than those who don't. Those who don't are just going to be left in the cracks, and we need to make sure and pick that up. Um, Pardon me. But yeah, I don't think the state has done enough. I think that Governor Justice has been he's been making some good points, but he's been slow to pull it back. I think we need to pull back a little bit. I think we need to start closing areas up a little bit more, and I think he needs to take a step up and make sure that happens, and not be aware of not be fearful of the political fallout, but do what's right. With that, thank you.
Okay. Thank you, Steve. All right, next up, we'll hear from Denise.
Well, I agree with what the previous candidates had mentioned. However, I have a little bit of a different take on that, is that I myself have a special needs son, and he cannot do virtual without having somebody assisting him the whole time. So there's a challenge there of, as you mentioned, is there broadband access, but is there the availability of the student to have the support that they need to be able to join in by virtual? So that's just a little point I just wanted to make. But I really believe that we need to have access to testing, that quick testing that would be present in the schools. And I really believe we need to increase the support of our healthcare people, whether we have school nurses, that we increase their being there in the schools and helping, and the school-based clinics that hours available, so if there is an issue, there's an assessment that's being done there to keep them safe. But I think the other thing is, I heard so many teachers mention that they didn't know what they were doing days before they were ready to go to school. And I think having a clear standard and making so that everyone is educated to what's going on, because the more you know, the more you understand. And I just think we could have done a better job at communication.
Excellent. All right. Next up, David Childers.
Yeah, this is why we have these forums, is to answer the tough questions and stuff like that. And this right here, this is a really tough question. I have to agree with Denise on a couple of her things with broadband and having special needs children and stuff like that. My children they're doing virtual school, and that's what we chose. But we jumped into the mud puddle with both feet on this right here, and of course the governor got his 64 crayon box out and decided to change the colors of the map. But we need to have the testing, like Denise stated. We need to have the access to the testing, the rapid testing. We need to the school-based health clinics. We need to give these people the funding that they need, the nurses, the doctors, the physician assistants to come in and detect that. I've also noticed where a lot of teachers didn't get the proper PPE that they needed. It's just not right. So again, I agree with what Corey and Steve and Denise said. Everybody is pretty much on par with what we need to do. It's just that those in Charleston right now is the ones dropping the ball and not listening to the people of West Virginia.
Okay. All right. And finally, let's hear from Robin.
Well, my husband and I both are public school teachers. So, COVID is on the forefront of our minds every day. We go in, we have our temperature taken, as well as every student. We have to have a mask on all day. The students are also required to wear a mask on the bus. So I believe that in our counties, we are doing everything that we possibly can to make sure that our students are back in the classroom if that's where their families chose to have them. And we're trying to do that as safely as possible. But the information was just slow to get out to families. With the lovely color-coded map, people are confused with that. The communication is key when there is a crisis like this. And I don't feel like that the communication was being met, and still isn't. Our students in this county go 2 days on and 1 day off, or they will go 2 days. Then we do not have any students at all in the building. And then another group will come in 2 days. So our class sizes are smaller, but counties all around us are starting to open back up to 4 days a week in seat time. And I think that that's a mistake. I hate to see anyone jump in too soon. I feel like we need to make sure that we're still educating everyone and cleaning and sanitizing and doing everything we can to keep our students and our staff and our families safe, because so many of our kids live with grandparents. So communication is key, and we are not getting what we need in that area.
Okay. All right. Excellent insight. Thank you, everyone. All right. We're switching gears here once again. All right. Question 3. All right. We know many women suffer from postpartum medical conditions that endanger both the woman and the child. Do you support expanding Medicaid to cover postpartum for up to 12 months at 300% of the poverty level? What else would you do to support the health of women and new parents in West Virginia? First up, we're going to go with Steve.
Yeah, I'll be honest. This is not an area that I know much about. I've never been married, so I've never really had an issue with. I've never had to deal with postpartum, but I know it's a serious thing, and I think anything we can do to create a better nurturing environment between the mother and the child from an early age is definitely helpful. I think that's a critical time, and I think not only with postpartum, but I think there ought to be resources available so that mothers don't have to worry about going to work. They don't have to worry about childcare. That if they do work, we need to have access to childcare provided. That needs to be more across the board and readily available. Yeah, I'm sorry. This is.
No, you're doing fine.
So,
If that's all you have
I'll-
to say. If you want to stop right there, that's perfectly
Yeah,
fine.
I'm fine. Thank you.
Okay. All right. Good deal. I appreciate it, Steve. All right. Let's hear from Denise.
Well, to share personally, I actually experienced postpartum depression with the birth of my first son, and it was very devastating. I had lost like 40 pounds in 4 weeks. I cried all the time, didn't know what in the world was wrong with me. And it is very serious, and it is something that needs to be looked at. I know there are people in this country who believe that postpartum depression is something that you choose. And I can tell you, it's not something that you choose. But I believe we really need to focus on educating and being sure that we have provided that education to the mom as to what are the signs and symptoms and when to go and get that care. So I definitely agree with expanding Medicaid to include the postpartum after birth and after giving birth. And once again, parent training and giving you those signs and symptoms. And, women, that's a very changing experience. You now have this little person that you're responsible for 24 hours a day. Guess what? You just can't pick up and go to the grocery store, because guess what? You got to take somebody with you. And I think, that whole experience of being a parent is overwhelming too. But postpartum depression and having services for the women of West Virginia after they give birth is very important. And really having screening. I worked for Birth to 3 and was really a great experience for me, but I think it's a very important program. And I think we really need to expand that Birth to 3 program, that it includes the mom as well on into that program, that the mother doesn't get dropped off. She should be allowed to be included in those services.
All right. Next up, David.
Yeah, 100% agree with it. I would almost take it one step further and go a little bit more than 300% above the poverty level, personally. Postpartum is it's just dangerous. It really is. We need to supply with counseling sessions. We need to expand WIC to where they would to where it would actually cover the cost of FaceTime appointments, expand it to where it would cover telephone appointments, education. I 100% agree with Denise. Would would not have one problem at all passing a bill to expand that. We could also, like I said, go one step further and provide a paid family medical leave. For issues that cover this. I mean, it all falls back on common sense legislation, folks, and that's and that's the bottom line. I keep on repeating myself. We have to start doing what's right for the people of West Virginia. I mean, how else could you not want to do that?
All right. All right. Thank you, David. Next up, we're going to hear from Robin.
Okay, sorry about that. Yes, I would definitely support expanding Medicare and Medicaid services to any woman, because postpartum depression is not something to laugh at. It's not something to be ashamed of either. And I believe that so many of our mothers are ashamed when they feel depressed. I mean, it's natural. Our hormones are all over the place. It's just like regular depression. And it's nothing that we should ever blink at. It's very serious. So mothers need to be educated. Education is key to anything. Communication between the mothers and the doctors. Birth to 3 programs are essential to helping mothers take care of their babies. And like Denise said, mothers need to be included in the birth to 3. The WIC programs need to be extended. Follow-up sessions need to be extended. You have your baby and you don't have to bring the baby back until he's 6 weeks old if everything was good. Well, what about the mom? The mom also needs to be checked in on. So those services need to be provided. We also, like David said, paid family and medical leave. Mothers should not have to worry about going back to work within a week of having a baby. Fathers should not have to go straight back to work. A family needs to be together. They need time to bond with that baby, and they need to make sure that their health is just as important as the child's health, because a family needs to be.
Right. Excellent. Thank you. All right. And last but not least, Corey.
I absolutely agree that Medicare needs to be expanded to at least a full year to cover postpartum for mothers and for fathers to be with their children. And it's a absolute shame that the richest country on the planet has a mortality rate, a maternal mortality rate that's going up. I mean, this is outrageous. We're the only industrialized country on the planet that has this problem. And it especially affects Black mothers and Black families, and that's just unacceptable. So I absolutely would support an expansion of Medicaid to cover that. I think that paid family leave and paid medical leave and universal child care are all 3 things that we need to push for. We have a lot of families that can't support themselves and need these programs to help them have a good life with their families. So it's good. The Senate Bill 564 was a step in the right direction, but we need to take it further. And I agree with everything that everybody said. We all seem to be on the same page with this, and I hope that we all get elected and can go to Charleston and make it happen.
All right. Excellent. Thank you, Corey. All right. Next question, question number 4. All right, we'll start with Denise Campbell on this one. We know that good vision care is a critical part of increasing one's quality of life and being able to stay in or re-enter the workforce. It is essential to obtaining and maintaining employment. Do you support providing vision coverage for adults through Medicaid?
That we shouldn't even be discussing that. We should already have it. I mean, your eyes are part of your body. And, I just am aghast every time I used to do case management, and I used to try to help people find ways to be able to purchase eyeglasses. And, if you can't see, you're going to be at risk for safety problems. How are you going to read? And for us not to have vision care is just atrocious. And, why we think that our eyes are not part of our body and it's not important to have, that's just a total, it's hard to even think that anybody would say, well, no, we wouldn't want you to have your eyes checked or have glasses. But I totally support adding vision and eyeglasses for adults, because it is going to help them maintain in the workforce or retain, be able to interview, be able to maintain their job, because vision is so important. I know a lot of people have been misdiagnosed, thinking, that people are unsteady on their feet or whatever. But if they haven't had good eye care and had screenings, we miss some very important things that could be picked up at a very earlier onset.
Thank you, Denise. All right, next up, we'll hear from David.
Yeah, just like Denise said, I can't believe that we're even discussing this. 100%. I mean, yeah. I mean, what else can I say? To say that we're not covering that is ludicrous. I'm embarrassed to even know that people can't even go get their eyes checked. And even if you do have eye insurance, I know I carry eye insurance through my employer, but it's so expensive to even for me to go over and get glasses. I have to buy readers, from the local store, and that's what I've been using. But yeah, we just passed the legislation. I mean, it all comes back, and I keep on repeating. I feel like a broken record, repeating myself over and over and over. You got to start doing what's right, guys. And to do that, it starts at the ballot box. You have to get people in there that's going to do the work for the people. It all comes back to the people, and that's what our government should be. But we keep on having these discussions of things that should already be in place. I just don't know what else to say. But yeah, I agree with Denise 100%.
Great, thank you. Appreciate it. Next up, let's hear from Robin.
I absolutely think that vision should be included. Not only vision, but there is no reason that vision and dental are not included in everyone's insurance. Why it's not included for Medicaid is just ludicrous. I mean, we say that we need to put people to work. Well, how are they going to go to work if they can't see? How are they going to go to work if they have poor vision and can't drive themselves there? And I mean, we all know that bad dental can have so many other effects on a person's body. It is insane that we have to pay extra, a huge amount on private insurance plans to have dental and vision covered. And it just blows my mind that it is not covered as a free service on Medicaid. We're supposed to be here for the people. It's not giving them free options. It's giving them a way to live successfully. And that, to me, is what we're supposed to be doing, finding ways to give people a helping hand. Not a handout, but a helping hand. And their health care is providing them a helping hand to make them successful in the workforce and in life. So it blows my mind that it's not already offered.
All right. Thank you, Robin. All right, and finally, we'll hear from Steve.
Yes, I agree with what everybody said, how important it is to have vision care covered. I'm like David. I get readers instead of going to the eye doctor because I know it's so expensive, and just the glasses are expensive to get them once you get the diagnosis and you see the eye doctor. So yeah, I think definitely it should be provided, and I agree with Robin. That was what I was going to mention was about dental. Your gums are the window to your immune system. If your gums are bad, then your immune system's bad, and we need to make sure that dental care is just as important too, because that is, in a place like West Virginia where where our children aren't getting good dietary meals, they're getting junk food, they're getting things that's not good for their bodies, that's not filling their mouth, all those things can have bad access on candy, can rot in the teeth. Candy can, it's just, we need to, again, we need to get a holistic approach. We need to start with eye vision, dental, and we need to go back to what we were saying before. We got to pay more attention to what's coming to our tables. And yeah, thank you very much.
Oh, yeah, sure. Thanks, Steve. All right. I did skip over Corey there. Corey, I didn't mean to skip over you there, but
No
we'd
problem.
hear
That's
from you.
okay. Again, echoing what everybody just said, it's shameful that Medicare basically cuts the head off of people, and that's a gruesome image. But what it means is, from your head down, they'll cover things, but they don't cover vision, dental, hearing, and these things are crucial. So the fact that we don't cover those things is shameful to me, and Medicare needs to be expanded to cover all those issues. And as a delegate, I know that all of us will work to make that happen. And we all know that when people are healthy, they can contribute to their economy, they can live good lives, they can be fulfilled and have good families. And that's crucial. I mean, what more do you need, right? I mean, clean water, good food, community. These are the vital things that make that bind our country together and our state. So I absolutely support expanding Medicare to cover vision and from the head down all the way. So I'm on board with what everybody just said.
All right. Excellent. Thank you. All right. Now we're getting to our final questions before your closing statements. All right. We know that people of color are more likely to suffer from heart disease, diabetes, postpartum death, and many other conditions. What would you do to address these structural inequities or inequalities and improve health outcomes for people of color? All right, let's start with David Childers.
Thanks, Adam, for that question. This right here is, it's a little. This one right here is a little personal for me. I have a biracial daughter and two nieces that are biracial. So this right here touches a little bit close to home. But what we need to do, we need to pass a Medicare for all, which is the bottom line. And like I stated earlier, we need to expand our outreach of free clinics in West Virginia, whether it be in the urban area, the rural area, or whatever. I would also propose a telehealth kiosk in rural areas that could be paid for by Medicaid. I mean, there's just so much that we could do with urgent care systems to have longer hours, education, and they create a public health option as well, that through the state to give people in rural and urban areas and people of color, the chance to actually get diagnosed sooner rather than later. It's just there. We just got to do it, and what else I mean, why not? But thanks for that question, Adam. I really appreciate that.
Sure, absolutely. Thank you, David. All right, next, I'd like to hear from Robin.
Okay, I mean, it all falls back on race and racism. We can't say that it's not an issue in the state, because it is. It's an issue clear across this country. And until we start providing Medicare for everyone, then we're going to continue to see people of color die from diseases that are treatable. Postpartum death and death during pregnancy is also highest in women of color, and it should not happen. We are in the 21st century in one of the richest countries in the world. We should not have people dying of simple diseases just for the fact of because of the color of their skin and because of what they can afford and what they can't afford. Medicare needs to be provided for everyone at an even rate. It should not matter what salary you make. You should be able to receive the exact same good Medicare as anyone else. I would also like to go even farther if I become a delegate and work with people to make sure that we can somehow have extra assistance to women of color while they're pregnant and after their pregnancy. Offer even more programs and groups for them to be able to join to make sure that they receive the connections that they need, along with the Birth to 3 programs and any other WIC programs. These services should be provided for everyone, no matter what your skin color, no matter what your bank account looks like. This is something that we have to do if we want to continue to be able to have a state with everyone.
All right. Thank you, Robin. Next up, let's hear from Corey again.
Sure. We know that systemic racism exists. It's in our face every day right now. Wake up, wake up, wake up. And here in West Virginia, it's a majority white state, of course, but we do know from data and science that Black people have more risk from dying from childbirth, more diabetes. The problems that afflict anybody hit Black families harder than they do white families. So I think the way to address that is basically make sure there's no redlining, there's no trying to block people out from healthcare because of their skin color. And I've been learning recently about a minority health advisory team and how Black folks in the state have been organizing to make sure that the public knows about these disparities, and they're collecting data and addressing this problem from the bottom up, not from the top down, and to really address those racial disparities and make sure that people know what's going on. So I'm obviously for anything we can do to help these people that are at a disadvantage because of systemic racism.
All right, Corey, thanks for your answer. Steve, let's hear from you. You're on mute, Steve. You want to turn off the mute first.
All right, I'm sorry about that.
No, that's all good.
Yeah, I think what really needs to happen, first of all, is we need to have a better outreach to people of color and to the minority community. But this isn't just enough. We need to look at, I think that what a few other people have mentioned is systemic racism. We're not going to solve this problem until we deal with the racism from the top down. That includes employment opportunities, access to medical care, access to resources that just aren't available to other neighborhoods, especially when you're talking about, there's a lot of correlation between, I think it's, while African Americans and people of color do suffer more than others, but it's also about class. We have to look at just the poor communities are being left behind, and unfortunately, there again, people of color misrepresented in those poor communities. So just a matter of, we need to quit talking about it. We need to just make sure to get some action and do something that's going to move us forward. We've had enough of the conversation, so let's just now try to do something about it. Thank you.
Excellent. Thanks, Steve. All right. And last but not least, Denise.
Well, it's always challenging when you're the last one to talk about a subject, because typically most comments are similar. But we have to remember that people of color, they do have just a hereditary risk that causes them to be at risk as well. And talking about poverty, making sure that we have employment opportunities, because when individuals are able to work, and then, I think the access to care and providing that education, because if we know this population is at risk, then it's our responsibility to be sure that we have the right screening tools, and that we screen whenever we know that this is a population. So we have to reach out to them, we have to educate them, but we have to be sure that they have access to care and that we provide screening for the diseases that they are high risk for.
All right. All right. Well, thank you all for the wonderful insight through these 5 questions. That is all we have time for. I'm sure we could talk about healthcare for a week or more. But I would at this time like to invite you to make closing statements. Each one of you will have a minute for your remarks. And we will start with Ms. Denise Campbell.
All right. Well, thank you again for giving us this opportunity. And to me, there isn't anything more important than your health, because we can talk about all kinds of issues that are going on in West Virginia. But if you don't have your health and you don't have health care coverage, that is a major issue. And I just want people to know that as someone who's worked in healthcare, I totally understand how important it is to have healthcare coverage, and I will work very hard to make that happen. As I said, I want to work together to make a healthier West Virginia. And as many have said, let's stop talking about it and let's do something about it.
All right. Thank you very much, Denise. That was Senate District 11 Democratic candidate Denise Campbell. Next up, we have David Childers.
Yeah, thank you, Adam, for having me. I really appreciate it, and thank you for giving us the tough questions. We're having conversations that need to be had, you know, and to do that, we have to hold these forums, and we have to have these tough conversations. But it all starts at the ballot box. You know, I said it before. You have to do what's right for the people. And having a Medicare for all, fighting for to cover pre-existing conditions, the expansion of Medicare, the expansion of our free clinics and stuff like that, and to supply all that, to give people just the help that they need. You know, it all starts at the ballot box, and I'll fight for every one of those issues, you know, that have been brought up. And I'm not corporate bought. I am not a corporate bought politician. Actually, I'm not a politician. So there we have it. Thank you.
All right. Thank you. That was Senate District 14 Democratic candidate David Childers. All right. Next up, we have Robin Cutlip.
I want to thank you for allowing me this opportunity tonight, because healthcare is an issue that's on everyone's minds. Either you can afford quality healthcare or you cannot. And that should not be the way it is in one of the richest countries in the world. Everyone should be able to receive the same amount of health care as anyone else. I mean, it should be equal across the board. It is something that I will definitely fight for. I'm all about giving a hand up to the people that need it, because that is what our state is made of. West Virginians take care of West Virginians, and it's about time that we start doing that again. I'll be a candidate that will fight for the minority groups and that will fight for our seniors. I will work to make sure that everyone is treated equally in this state, because we are the best state in the world, in my opinion, and it's time that we start taking care of each other.
Excellent. That was House District 44 Democratic candidate Robin Cutlip. All right, next up we have Steve Hamilton. Steve, you still with us? Uh-oh. All right, Steve jumped off here. All right, so that Mountain Party, House District 48, Steve Hamilton, he was with us tonight, jumped off for some reason. I'd like to wish him the best. Next up, we'll hear from, last but not least, Corey Chase.
Thank you, guys. Thanks for having me, and thanks to all the candidates that are running and taking the risks. I'm Corey Chase, and I'm a candidate for the West Virginia House of Delegates, District 53, Preston and Tucker counties. And I kind of take issue with what David has been saying, and I just challenge him to say that voting takes about 20 minutes every 2 years, but organizing and activating and getting people engaged in these campaigns to take back our government, to fight for the things that we believe in, to fight for progressive values, that's the work. That's what we're all doing. And if you want to help candidates call them, get in touch with them. You can go to my website, chaseforwv.com. You can sign up to volunteer. We've written 5,000 postcards, handwritten postcards. We're about to phone bank. We're going to do some door hangers. So there's ways to help out before you go vote. And I encourage people to vote, of course, but it's going to take more than just voting. We need to get people fired up, engaged, and inspired. chaseforwv.com. Thank you guys for having us. It's been a great forum. Thanks a lot.
All right, excellent. All right, that was House District 53 Democratic candidate Corey Chase. All right, we did manage to get Steve Hamilton back on. So without further ado, Steve, the floor is yours. 1 minute.
All right, thank you very much. I keep losing my internet connection, so hopefully it'll stick around till I'm done. But I want to thank you for this opportunity. It's really great to see other like-minded candidates, and I hope that everybody on this call gets elected, because with all the more like people we have, the greater we can get things accomplished. I do think it's important that we expand Medicaid, and we expand it to touch all the issues we have talked about with mental health, dental health, visionary. But more importantly, we need to stand as a unit too. And we need to force our federal legislators to come up with healthcare for all. That is what we really need. And while we can do a lot state to solve some of the problems, but it's a Band-Aid, and what we really need is national Medicare for all. Thank you.
All right, excellent. Well, thank you so much to all of the candidates who participated in today's forum. Thanks to our audience for sticking around and listening to these very important issues. And I'd like to thank People's Action, Tim Wilkins and Marlene Paez for their technical assistance. Without them, this would not be possible. To get my good side on camera. And I wish each one of you all the best of luck in the upcoming election. I know the finish line is right there in view, but you still have quite a sprint in front of you the next month or so. So without further ado, I turn it over to Lisa Deal. Lisa, you're on mute.
Okay, thanks so much, Adam, for doing a great job on moderating our West Virginia North Central Candidate Forum this evening. I also want to give a special thank you to all the candidates who participated this evening. Thank you all so much. We have 2 more candidate forums coming up. On Monday, October 12th, we'll be in Kanawha County. Our Cabell County Candidate Forum is on October 19th, and they will both be held at the same time at 6 p.m. And finally, please vote. Here are some dates to remember here in West Virginia. October 13th is the deadline to register to vote. October 21st through the 31st is early voting, and make sure you bring your ID and a mask. October 28th is the deadline to request your absentee ballot. And of course, November 3rd is Election Day. So the polls here are open from 6:30 a.m. to 7:30 p.m. Again, bring your ID, wear your mask, and remember that November 3rd is also the deadline to mail in your ballots. So thank you all again for joining us, and please enjoy your evening. Thank you.